Diagnosis and treatment of herpes zoster. Herpes zoster or the shingle is the reattack of the varicella zoster virus in the same person who have recovered from the chickenpox in his early life. The virus is the same one, varicella, but the manifestation of the disease they are different. For diagnosis, routine blood complete pictures is performed to detect the level of the sugar, level of cholesterol, ESR, these factors, and moreover we have to culture the blood sample to detect the viruses causing this disease, to differentiate between the viruses and confirm the diagnosis. Then detection of the antibody produced by the immune system in the blood, IgM, by the PCR test, which is a very confirmed test and reliable test. As this disease appears after the age of 50 years when the immune system is weakened. In the first part of the life, the same person had suffered from the chickenpox and recovered, but the viruses still live in dormant phase in the neurons, the ganglion of the nerves. When the stage occurs after 50 years, person is weakened due to age factor or the other chronic ailments. So these viruses reactivate and produces the shingle or the herpes zoster disease. The rashes undergo various stages. First there is red rash over the dermatomes, the area of the skin supplied by the nerve fibers which are inflicted or attacked by the virus. Then macules, papules, vesicles, pustules, and later on the recovery phase there is scab formation and there is ulceration and the material or the fluid which is filled in the blisters they rupture and they causes the dissemination of the disease. But this is important factor that this varicella containing the fluid when get entry into the second healthy person, there this causes the primary infection, that is the chickenpox in the infected persons, not the direct shingle disease. Shingle disease would appear or may appear in the infected person after the age of 50 years by the reactivation of the same virus. Treatment is symptomatic, antibiotic to lower the fever like ibuprofen, paracetamol, painkillers, analgesics, NSAID medicines, Proxen. These are used in oral form or injectable forms. Then the most effective treatment to reduce the complications and the progression of the disease or the antiviral treatment, which must be started immediately after the appearance of the rash within 72 hours. It is only effective when immediately start antiviral treatment to reduce the symptoms or the trouble to the patient and the complication of troubles. So various antiviral medicine are used, acyclovir, famciclovir, gelcyclovir, but the mostly time honored or the used is the acyclovir in the form of oral, systemic or IV therapy according to the severity of the symptoms. So antiviral therapy along with steroid initially in reduced quantity because anti-inflammatory action has to be provided by the steroids because the irritation and the inflammation of the nerves may cause post-herpetic neuralgia. So, in to avoid to the complications of the disease herpes zoster, we have to start the immediate treatment with antiviral and the steroid, along with the other symptomatic treatment. When the complication occurs, they are very deadly, very prolonged one, because when there is post-herpetic neuralgia, that may prolong up to several years, and for that, careful and prolonged treatment under supervision of the competent health care provider is essential to reduce the agony trouble to the patient. So these complications are to be avoided by the immediate care and the start of the disease or treatment.